Tell me exactly what's happened.
She's collapsed. I don't know what's happening.
In Melbourne's Emergency Communications Centre, a panicked call for help is coming in from a farm 300 kilometres away in Alpine, Victoria.
Is his breathing completely normal?
He's breathing. Well, I just did his blood pressure was really low.
But is he breathing?
Yes, I think so.
Okay, is he changing colour?
No, you're not all right. You're on the floor. I'll get up in a minute.
While in the background, the patient's insisting he's okay. His symptoms all point to a heart attack.
Is he changing colour?
Yeah, he's cold and clammy.
Okay, I'm organising help for you now.
An air ambulance team is immediately mobilised from the city. Micah Flight Paramedic Ray knows the 72-year-old patient could be only minutes away from a cardiac arrest.
Our ETA is approximately 45 minutes.
Roger, thanks very much. 173 will meet you there.
The high country is one of the most beautiful places in Victoria. But you live out here, you're miles away from medical attention when something goes wrong.
So we might approach basically along that track running through the pad from our right 3 o'clock, mate.
If it's confirmed this patient's having a heart attack, he's absolutely and unconditionally time critical.
A local ambulance crew has already picked up the seriously ill patient and is bringing him to the helicopter.
Okay, so this is John. He has collapsed on the floor of his home. His BP sitting around the 56 on 40 kind of thing.
Okay.
12-lead ECG shows inferior STEMI.
A STEMI means a clot that's stopping the blood flow to the heart. And so it actually means your heart muscle's dying.
So, John, notice anything unusual when you're out farming?
Oh, short of breath
all the time?
Especially walking. I can walk, but an old lady will beat me.
There is a saying in medicine that morgues are full of blokes who ignore symptoms. If you get serious signs like shortness of breath and fatigue and chest pain, there could be some desperately bad things happening within your body and you really do need to see a doctor.
So what we're going to do, we're going to put all our stuff on you and quickly get you up and out of here.
The local paramedics have already given John a clot-busting drug to open up the artery to his heart. But it's only a short-term solution.
We don't know if that vessel's going to block again. If it blocks up again, which it really could at any second, we could go into a cardiac arrest literally in a millisecond.
All right, off to the Royal Melbourne for you. 45 minutes, we'll be there.
This situation has us on peak alert. John has a massive potential to deteriorate. So for us, it's let's get going as quick as we can.
How can you make an egg laugh?
How can you make an egg laugh?
Tell them a funny joke.
Tell them a funny joke.
Back in Melbourne, Amanda and Taz are starting their shift on a much lighter note.
I have a good one for you. What do you call a chicken that counts its eggs? A mathema-chicken.
But the yolks are quickly over.
We were just on a patrol and we've come across a gentleman. He's breathing, but he's sort of got the shakes. We can't get anything out of him.
A protective services officer has found a suspected drug-affected man outside the Melbourne West Police Station.
Will they be able to find you there?
Yeah, we'll flag him down.
When the job comes as drug affected, the first thing comes in mind, what kind of drugs? So someone who's taken a heroin overdose can go unconscious compared to someone who's taken an ice, where they may present possible violent behaviour.
Saying something about medication, but we can't sort of make any sense out.
Okay, let's go and find out.
Oh, he was just sitting there, was he?
Yeah, when we came out on our patrol, he's just sitting there hunched over.
Is he known to you guys at all?
No.
Nothing in his pockets? You guys have searched him and that?
If he's got syringes or knives, scissors, anything that can harm our safety, we want them out of the way.
It's ambulance here. Hello? Open your eyes, mate. Open your eyes. Can we take this bag out for a second? Thank you. I'll look after your bag.
Have a look and see if there's a wallet or something in it.
With the patient so unresponsive, Amanda searches his bag for more information.
Have you taken any drugs or alcohol? Medication? Medication for what?
That's really, really helpful, actually. Just on Mataz.
That's it?
Just on Matazepine, yeah.
Mirtazapine is an antidepressant drug often prescribed to people suffering from severe anxiety.
Yeah,
You've taken 20 of these, so you overdosed on tablet. Okay, well, we need to take you to hospital.
These drugs are pretty strong and they can have some pretty significant side effects. To take 20 times the amount you're supposed to could have dire effects on this patient.
Yeah, your bag's coming, mate. It's okay.
Take your bag. We'll take your bag.
You can never drop your guard in these kind of jobs. 1 minute they are completely relaxed. Next second they may present quite a physical aggression or danger towards paramedics.
It's me.
Okay, so he's really gone aggressive now. Let's call the police officers.
No, dog, we're coming here. I'm scared. Mow him. No. Why not?
By this patient's behaviour, it's pretty evident that he hasn't just overdosed on the antidepressant. There's something else at play here, and it's really important for me to find out exactly what substance we're dealing with.
Have you had heroin today?
No.
Have you had synthetic marijuana today?
No.
Recently used ice?
Yes.
When was the last time you had ice? Yes, this
Yeah,
morning?
This morning.
You had it this morning?
Patients on ice can be really unpredictable. They can be very violent. We need to get both of us to the hospital safely.
He's all right. He's going in here.
No, it's just me.
You go.
He's watching me.
No, but he can't drive.
It's not your rules, it's my rules.
I'm listening to you.
Yeah, so listen.
I feel a little bit sorry for this guy, and I just need to be nice to him. He deserves just as much respect as anybody else who gets in the back of my ambulance.
How's that, a bit better?
We've got a police officer in the back, okay?
A policeman will be travelling in the ambulance to make sure everyone stays safe.
It's all right, mate. I'm just here to help you. Make sure you're safe, all right?
There's just a policeman there.
Get my phone.
No one's going to take your phone, it's all good.
Because they all know that I've got the evidence they need.
This guy is obviously having a psychiatric episode, so this transport is not going to be easy.
In Victoria's Alpine country, Flight Paramedic Ray is preparing to emergency airlift 72-year-old John to a Melbourne cardiac unit.
Just for your eyes there, John, okay?
Okay, you're in the middle of our paddock.
The farmer has just had a massive heart attack. He's only alive now because his cousin Lauren came home in time to raise the alarm.
He was lying on the couch and I took a look and he was real sweaty and clammy and really cold. So I said, I'm calling the ambulance. And he sort of come to and no, I don't need an ambulance. I'm fine. I'm thinking, you're not fine. If I hadn't called the ambulance, I don't think he'd be here.
There's the cows, Lauren.
No, the cows are right there down the bottom paddock. Don't you worry about it. We've got them all organised.
We run the farm together and I don't think I'd be able to continue on my own. With John's granddaughter, I don't think we'd manage.
Stay with me.
Despite his critical condition, John's still barking orders.
What about water?
You want a sip?
They're giving you
Yeah, I wouldn't mind a sip of my water.
Your water. You got special water? Can't even drink Melbourne water. I don't even taste the
I
quality.
wouldn't even wash my teeth.
Country guys, country people in general, tend to be laid back when everything's against them.
Suddenly, John's heart rate and blood pressure plummet.
Is that rhythm changed again? Yep, it has too. And yeah.
Ray is back on high alert.
And he starts looking terrible again. So basically that clot's reformed. His heart's getting deprived of oxygen, and the end result of this could be a cardiac arrest. And it could just happen at any time.
The only way to fix John is emergency surgery to unblock his arteries. But it will take at least 45 minutes for the chopper to get him to the Royal Melbourne Hospital.
50 feet, 2 hours 98 there.
We don't know how it's going to end. Kind of doing this a little bit. With a patient like John, chaos could be just around the corner.
When did you start injecting ice? 3 weeks ago.
3 weeks ago.
When did you start smoking it?
Oh, about 4 or 5 months ago.
Right.
Back in Melbourne's city centre, Amanda and Taz are heading to hospital with their distressed patient. He's overdosed on antidepressants and taken ice.
So you're just having a hard time at the moment?
It's just nothing wrong.
I think to be a true paramedic, you have to be compassionate. There's always a reason behind why people are in certain kind of situation.
Who are you calling?
My mum.
Your mum.
Hello?
Oh, Mum, I'm in an ambulance because I take lots of tablets because of all this stuff on social media, Mum.
Don't take no more tablets.
You come pick me up, Mum.
I can't come down and get you because my car's no good.
Just let the drive down and get me, please, Mum.
I can't.
Mum, please.
It's really heartbreaking to see someone in that situation. Do you know, he goes from being this drug-affected adult to being almost a child.
You're in the best place.
No, Mum, no.
Yes, you are.
Please. Please, Mum.
I can't.
Please, Mum, come and get me.
Can I speak to your mum?
No, just hang up on me.
Did you hang up on her? I think you might have hung up on her. I can speak to her and tell her what's happening. Oi, 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 stop!
I can hear this patient getting angry, shouting, ranting in the back.
Stop, that's got glass on it. You're gonna hurt yourself.
I'm not going to put
You're gonna hurt yourself.
You're not taking it.
This is getting dangerous now. I need to get out and protect Amanda.
You need to stop.
Thames 1, we're airborne for the Royal Melbourne now with an ETA approximately 1610.
72-year-old John is being airlifted from his farm in the Victorian High Country after a massive heart attack.
Imperious STEMI diagnosed.
Flight paramedic Ray is concerned his critically ill patient could go into cardiac arrest on the 45-minute flight back to Melbourne.
His blood pressure wasn't very good. His heart wasn't functioning very well.
BP 117 on 5-4. He is on 5 mics a minute of adrenaline, but we're just titrating that.
Thanks, Thames 1.
Roger.
John is an absolutely time-critical patient. His heart's a ticking bomb. If it stays unclotted and his blood vessels stay unclotted, all good and well. If it doesn't, that actually means his heart muscle's dying. Best way to describe it would probably be you have an orchestra. Every little heart muscle is its own little instrument. If they're not playing together, you're chaotic. And if it's chaotic, your heart doesn't beat properly, quivers, or it goes too fast and it's unregulated. That's immediate death.
It's been a tense flight, and the air ambulance team are happy to see the Royal Melbourne Hospital finally come into sight.
You good there, John?
But John's fight for life is a long way from over.
A couple of bumps as we come out here, John, all right?
A team of cardiologists are on standby to take him straight into theatre.
So John's got significant cardiac vessel disease. There's only one way to fix this problem, and that's to go into surgery and get the pipes unblocked manually. And he's in no way, shape or form out of the woods.
Oi, 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 stop!
In central Melbourne, a patient on ice is becoming increasingly distressed.
You're gonna hurt yourself.
You're not taking it, I'll hold it.
Taz has now stopped the ambulance in case the man turns violent.
Hey, we're not taking your evidence off you. Hey, enough. Okay, so just stop.
Before I realise it, Taz is at the side door because he's pulled over to make sure I'm okay.
We haven't taken your phone off you. I just want you to not hurt yourself.
These jobs are a highly volatile job. We have to be prepared for these kind of reactions all the time.
Just relax. Are we relaxed? Are we calm? I understand that you're going through a really tough time at the moment, okay? And we're gonna go and get you some help. The police officer behind you has got your phone, okay?
I'll keep it safe.
He's gonna keep it nice and safe for you.
The tin policeman.
No, that's a real policeman. If the police officer has it, it's nice and safe. Let's just go to the hospital. Yeah, seatbelts are all on.
Driving in the front, sometimes you feel like you're helpless. But having Victoria Police in the back, it just gives reassurance that my partner is safe.
Yeah, Roger, we are upgrading to Code 1 to St. Vincent Hospital along with 56 for safety reasons.
It doesn't matter sometimes how much support you get in terms of medication or treatment or from the hospital. Just being lonely is probably the toughest battle you can have in your life. As a paramedic, the biggest challenge for us is to make them realize that we haven't given up. We are their family. We are their hope.
As dusk falls on Melbourne, Nat and Leonard are starting their evening shift with an unusual call-out.
Oh my God! Patient was having sex when he heard a loud crack. Penis is now spurting blood.
Oh my gosh.
Oh my God.
Our job is very much paramedic bingo. We never know what we're going to go to. Okay.
Okay.
So first things first, game plan.
Well, the only way to control a hemorrhage is with digital pressure. I don't know what you're laughing about, but I'm a professional. And if I need to apply pressure to control the hemorrhage, then so be it.
It's important to actually have a laugh, get it out of our system so that when we get on scene, it's game face.
Where are we taking him? To the Alfred?
Yeah.
Yeah?
But before the team can get to the job,
No!
Why? What's happening?
a closer ambulance has been assigned the job.
715 received cancelled.
But this night's about to have another surprising twist.
Bitten by a funnel. Funnel web?
Funnel web! Oh my God.
Tell me exactly what's happened. My daughter's, who's allergic to dairy, may have had something and she's reacting at the moment. How old is she? She is 3 years old. Okay.
On the Mornington Peninsula, intensive care paramedics Doddsy and Cam are also responding to an emergency. A tiny patient is in trouble.
Does she have difficulty breathing or swallowing? The breathing is not normal. Okay. Has she ever had a severe allergic reaction before? Yes, she has.
Hives under armpits, neck, looking very uncomfortable. If this kid is truly anaphylactic, you know, minutes count.
Absolutely, they do.
The toddler's distraught mum has pulled over on the side of a highway.
We want to find this patient as soon as we can because what might have started as a simple allergic reaction could become full-blown anaphylaxis very quickly. It can lead to them going unconscious and, if untreated, possibly cardiac arrest.
So this is Craigie Road here, and I reckon if we sneak just to the right and have a look, we should see a car with its hazard lights on here.
Looking.
Yeah, hazards. Did I say hazards? No, maybe I didn't.
The Micah paramedics are struggling to find their patient.
Murdoch Highway, Craigie Road.
Back
so
there.
it's back down there.
It says on this roundabout.
When we get to the address that we were given and they're not there, we start thinking there's a 3-year-old that needs an ambulance now. We could be driving around for another 5 minutes before we find them, and I hate to think what could happen within that 5 minutes.
Go that way, go that way.
I don't think they were a Victorian.
You saying there are no funnel webs in
I
Victoria?
didn't think that was in Melbourne.
Nat and Leonard's bizarre night has just become a little bit stranger. They're now on the way to a suspected funnel web spider bite.
It's bitten me on my finger. I've just been vomiting. It happened about 10 minutes ago. Okay.
Keep calm, do not move at all, and wait there for paramedics, okay? So it's really important that you try to stay as immobile as possible.
Yeah, my head's feeling sore.
Funnel web spiders are found around the east coast and the highlands of Australia, from Queensland to Tasmania. Do you know what they look like?
Big, black, ugly,
Scary.
disgusting.
We know that the Sydney funnel web spider is one of the deadliest in the world. I'm not really looking forward to meeting its Melbourne cousin. Patient unstable, here we go. It's gonna be Can we upgrade? Yeah, let's do it. We're not really sure what we're going to. We could be dealing with a very, very unwell patient. She's been vomiting, she's feeling hot, and she's complaining of a headache. So there's lots of symptoms here. It's gonna become a 1. Yeah, it's a 1. Go, 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 go.
I'll go to the roundabout and I'll turn around.
Yep.
How am I looking yours? Okay.
Yeah, clear, let's go.
At the Mornington Peninsula, Cam and Doddsy are still searching for a 3-year-old patient who's believed to be having a severe allergic reaction.
There could be a critically unwell kid sitting in a car waiting for an ambulance and we can't even find them.
I reckon we head back down that.
Yeah, absolutely. I'm going to go across here.
Hang on, I'll just see if they're down to the left.
There they are.
Ah, yeah. We've located, thanks.
And they're standing on the side of the road holding a child.
Yeah.
We can see that the car's on the side of the road. It's in a precarious position, but Mum gets out of the car and starts carrying the kid.
They're coming straight to the car, so they're literally walking to the side of the car.
Hello, too dangerous here. We need to move.
The fact that Mum's a little bit panicked makes me think, is this kid really unwell?
Is she okay?
I'm just worried about her breathing.
Okay, I'll get you to follow me up here.
But once I can see that she's conscious and alert and looking around, I've got time to have a bit of a breath.
What's your name?
Anne.
Anne, I'm Cam. What's your name? Inna.
Annalise.
Annalise.
We call it Anna. See, she's
Anna. I just want to pull up and off
Yep,
the road
sure,
there,
sure.
and then we're safe,
No worries.
okay?
Just moving up.
Thank you. So tell me a little bit about her, about Annalise.
She's allergic to eggs, dairy and peanuts. Today we gave her a bit of a burger and I think she reacted to it. They may have been mayo in it. I don't know.
Okay, yep. So an egg-based product.
But that was around 4 o'clock. But she's been coughing. We've given her Zyrtec.
Yeah, great.
3 drops of Zyrtec. And she just started to really itch around 5 o'clock.
Okay, could you just take her top off and we'll just have a look?
With the story that Anne's telling me, the cough and the itch and the rash, it starts to paint the picture that this could be an anaphylactic reaction. This could be severe. And it's obviously progressing because she's given her an antihistamine and she's still showing symptoms.
Now, can I have a listen to your breathing with my doctor's stethoscope? Is that okay?
Yeah.
Good, thank you. I have a little listen. It gets a bit cold, okay? A little bit cold.
I've found in the past that kids sometimes get really scared at what's a paramedic going to do? Like, are they going to do something that's going to hurt me? So some of the equipment that we have to put on, I like to make up little games.
This is my hug machine. Oh, you know what to do.
I use these little tricks just to try and distract them and make them feel a little bit more comfortable.
Can you poke your tongue out for me? Good girl. And your lips? Any pain, any tingling? So oxygen levels are excellent. Her heart rate's quite good. But she's got full inspiratory, expiratory wheezes. And we've got a rash down in the thighs there. It's more of a welt rash, Doddsy, but she's got respiratory involvement as well. So what I want to do is treat her as if it is an anaphylactic reaction at the moment.
I've drawn out 0.1 of a mil, which will be 100 mics.
Okay, so
the adrenaline that I'm going to give Anna, hopefully, will fix the breathing problems that she's got and open up her airways, but we're going to have to give her a needle, and I know she's not going to like it.
Tiny sting. Tiny sting, hun. Sorry, love.
I'm sorry, sweetheart.
Sharp out.
That's all.
All done.
Here you go.
I'm sorry, hun. I'm sorry. Sorry, Anne.
Doddsy now needs to get them moving to hospital. On the way, Cam will closely monitor Anna's vital signs to make sure she doesn't deteriorate.
You happy?
Yep.
Okay. Happy to go. Thanks, Paul.
Righto, mate.
From here, one of two things could happen. The adrenaline could resolve all of Anna's symptoms, or it might not work at all and she could continue to get worse. At the moment, I'm not sure which way it's going to go.
So my understanding was funnel webs, they get compression, redbacks don't.
Yeah, right here.
Perfect.
Leonard and Nat have arrived to check out a young woman who's reportedly been bitten by a highly venomous funnel web spider.
Hi, sweetie. What's happened?
I was rolling the smoke.
Yep. So hand into the pouch of tobacco.
Yep, put it in there, felt something on my finger,
Yes.
and then I saw it, and then I just threw the whole thing away.
Okay, are you certain it was a funnel web?
Well, that's where they all are. So.
Okay. Where were you bitten, Jess?
On my finger, yeah.
The right finger there?
Yep.
Okay, and?
About 10 minutes after, to get really hot and sweating, and I started throwing up.
How many times have you thrown up?
Twice.
Okay. Do you feel dizzy at all?
Lightheaded.
Yep.
Very hot.
And do you still feel nauseated in the stomach?
Yeah, and I feel really hot.
Really hot?
Yep.
Okay.
If it is a funnel web spider bite, that venom could be quickly circulating around this patient's body. And if that happens, within a few minutes, the patient can deteriorate. Think in the truck, start moving, assess. It could seriously end up as a life or death situation.
Hey mate, how you going?
Doxy, good to see you.
Good to see you. How was your holiday?
Also on the night shift, Mike's catching up with Eamon after his partner took a short break to Bali.
I actually got you something.
Okay. I know you love your utility belt.
Oh, God.
And you look like a bit of a nuffy with a utility belt, but I disagree. So
Batman doesn't look like a nuffy.
So I thought you could maybe wear this T-shirt with pride. Utility belts.
Man,
cool.
I'll wear that under my uniform. That's fine.
Mike is hands down the biggest dag I know. He's late 20s going on late 60s.
You think this is a joke? I love this. I have to buy you a coffee.
But coffee will have to wait.
All right, let's put this away.
An urgent call has just come in from a woman in distress.
Emergency services, tell me exactly what happened.
I'm short of breath. When I breathe, they stab me around the heart.
Okay, I'm going to get you help.
We're going to a 72-year-old female who's short of breath and has pain in her chest, and that's all we know.
Mike and Eamon are now heading lights and sirens to this time-critical case. But details are in short supply.
Pain in the chest with shortness of breath, you know, that adds a layer of complexity. It may not be a heart attack, but it could be like cardiac failure. Yep. Perhaps. There's so many things that it could be. I'm thinking, is it a chest infection? Is it their heart is failing and they're getting a build-up of fluid in their lungs? Or is it something as serious as a heart attack? With a 72-year-old patient, all of those things are highly probable. Her name is going to be Toddler. Toddler.
After sorting out the clinical possibilities, the boys have time to play their favourite game. Guess the patient's name.
Toddler, what do you reckon her name's going to be?
Ingrid.
Ingrid or Toddler? We're heading into a very Greek suburb. This could be the one.
Let me just back her up a little bit, mate.
I reckon her name's going to be Toddler. I'm feeling bloody good about her name.
Yeah, bloody good. Well, I owe you a six-pack if it is.
I want a whole slab.
Now, don't accidentally call her Toddler.
Yeah, g'day, Toddler.
How do you know? The excitement's building. We rock up to the house. Hello, my name's Eamon. What was your name? Milia. Damn. What's been happening today?
Short of breath.
Okay.
And all my bones crashing, all my joint and headache and...
Okay. All right. And you've got pain in your chest, do you?
Yes.
Can you point to where it is?
In here and they go that way, underneath the shoulder.
Underneath your shoulder?
Yeah.
Okay. Anytime a patient tells me that they've got stabbing pains in their chest, it's a red flag straight away. Does it feel heavy or it's like someone sitting on you or like someone stabbed you with a knife?
I can't. I'm short of breath.
No, I can see that. I just want you to lean forward and I'm going to have a listen to your breathing.
A patient with chest pain can have a major heart attack, collapsed lung, major chest infection leading to like blood poisoning or sepsis. There's really serious conditions in there that can be fatal.
We're going to look after you and take you up to the hospital, all right?
Do you have a nest of funnel webs?
Yeah.
Nat and Leonard are preparing to move Jess, who could have been bitten by a dangerously venomous funnel web spider.
They're like all in the holes, like
right.
You can't actually see them
right.
until they come out at night.
Right.
The family, who are renting, have been living in fear of the spider since they moved in.
You've got a child, do you? Or
I've got three. They don't go outside though.
Because of the spiders?
Yeah.
Okay. The thought of spiders coming out of the walls at night, it's just the stuff of nightmares. I couldn't imagine anything worse. And is this...
husband.
And you'll stay here with the kids? And you know you've got the oven on. Do you want me to turn it off? I automatically go into that mum mode. I just want to make sure that everything is organised. Just that one. The oven's turned off. You know, no one's going to hurt themselves. And then we're not going to be coming back to pick up another patient. The kids had dinner?
Yes.
Yeah, they're good?
Husband.
Okay, your dinner's in the oven. Yeah, I know. Work it out.
We need to hope for the best. We need to treat for the worst.
Are you in pain, Jess?
No, I feel really sick.
Do you? Like you're going to vomit again? Okay.
We've got a vomit bag right next to you.
The standard procedure for any funnel web spider bite is to apply compression to the entire limb. Before they can leave, Nat and Leonard need to bandage Jess's entire arm.
Fortunately, they have to be put on quite tight. Just keep it still. You're going to feel like a robot. What we're trying to do is prevent the venom from going back to the heart and then spreading around to other vital organs.
You all good, Nat?
Yeah. Well, we know that funnel web spider bites can be fatal, so even a little bit of venom can have serious side effects.
Her heart rate's still a little bit elevated because I've given her a little bit of adrenaline.
Yep.
So I'm just going to monitor her.
Intensive care paramedics Doddsy and Cam are on their way to hospital with 3-year-old Anna and her mum, Anne. The toddler has suffered an anaphylactic reaction after eating a burger with mayonnaise earlier today.
Anaphylaxis is one of those things that there's something in her body causing an extreme inflammatory response. And what I've done is almost put a cap on it, but when the adrenaline wears off, some of those substances can override that inflammatory response again. So I'll have a listen to her breathing and see if we've helped her. If we have, fantastic, I'll leave it alone. But if not, I might have to give her another one.
Yep.
I'll have a little listen to your breathing again, okay? Big breath. What about your tongue? Can you poke your tongue out at me again? Does it feel puffy? It does.
So when I look at Anna, the welts have gone down, but she's saying that her tongue feels a little bit swollen. This is a major concern because kids only have small airways. If Anna's throat continues to swell or her tongue swells, she could occlude her airway and she wouldn't be able to breathe at all. Then we'd be in real trouble.
Okay, special mask. Let's pop this on. Big breath for me. Big breath. Good girl.
Cam's giving little Anna a second dose of adrenaline, this time administered through a face mask.
And are you okay? Yeah, cool.
Hopefully it will keep her airways open until they get to hospital.
Just pulling in now.
Beautiful. How do you feel? Just a bit tired now?
Anna will now be taken straight to emergency for further testing and observation.
Okay. Right to move out, nice and easy.
Anna's pretty lucky that her mum was so switched on to the fact that she was deteriorating and it was out of the normal. She was more severe than she had been in the past, so ringing an ambulance was spot on.
All right.
How's the nausea?
It's still there.
Still there?
Yeah.
Okay.
Nat and Leonard are also on their way to hospital with suspected spider bite victim, mother of 3, Jess.
You've done all the right things. You've sat down, you've kept still, all the things that we'd be looking for.
They've bandaged her arm and are now trying to keep her as calm as possible to stop the dangerous venom from the funnel web spider spreading around her body.
So how long have you been renting there for?
3 years.
Okay, and how long have you had the spiders for?
3 years.
Oh my goodness, so they were there when you moved in?
Yeah.
So this is an ongoing problem?
Yeah, it's too expensive to move.
Yeah, well, you've got 3 kids. You full-time mum at the moment?
Yeah.
Yeah? It's tiring, isn't it? I feel like I can relate to Jess a little bit. We're both mums, 3 young children. I've got a 4-year-old. He goes to the toilet and he goes, Mum! I go, what? Wipe my bum!
Is that what I've got to look forward to now?
You do. Leonard's having a baby in a few weeks. Have you ever heard of a punami?
Oh, no.
You know what a punami is?
Is that like a number poo-poo explosion?
Sometimes I can't tell the difference between when Nat is telling the truth and when she's just trying to rev me up a little bit and scare the crap out of me.
That better be a myth.
He's having his first. He's got no idea. Oh,
I'm not listening now.
you have no idea what's coming.
La 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 la.
I'm actually worried. I just don't think I'm going to have another kid after the first one, if that's true.
While Leonard deals with first-time father jitters, Jess will now be taken into emergency and kept under close observation.
Okay.
She is still at risk of a life-threatening reaction if too much of the venom is circulating in her system.
Will your husband be able to make himself dinner?
Without burning the house down. Although if he burns the house down, he might burn all the funnel webs.
Yeah.
If you take a big breath in, for example, does that hurt?
Yeah.
In Melbourne's southeast, Eamon and Mike are trying to work out what's causing the stabbing pains in Milia's chest.
Just gonna pop some
Are
stickers.
you bringing anything up? Any phlegm? What colour is it?
Yellowish.
Like a yellow colour. Okay.
Patient with chest pain can
have a heart problem and a lung problem simultaneously. If the heart's not pumping effectively, fluid or blood builds back up into the lungs and you can essentially drown on the inside.
Are you a smoker?
Yeah.
Yeah.
How much are you smoking at the moment?
10.
10 a day? She's coughing up some gunk, her bones are aching, she's got a temperature, and she's feeling short of breath.
ECG is normal. I think it's definitely all fitting a pleuritic sort of pathway.
This is sounding less like a heart attack and more like a very serious infection. Did that make the pain worse than when you had a cough? Yeah. Yeah. That's what's giving you this chest pain. Because you're coughing so much, you're straining the muscles in there.
There's not much we can do for the cough, I'm afraid, but the pain we will try and help, and we'll take you to hospital for some tests. You need a chest X-ray and some blood tests, all right?
Chest infections, in the beginning, they're quite benign, cough, cold, runny nose sort of thing. For a patient like Amelia, she's older, she's a smoker, she's got lung problems. It can progress to be quite serious, and then because her immune system's not as good as a younger person, it can spread to other body systems and eventually lead to organ shutdown and death.
All right, Eamon will come in the back with you, OK?
I'm good to go when you are, mate.
Moving on.
Amelia needs to go to hospital. We need to get on top of this before it gets on top of her. Heart rate's good, blood pressure's good, stats are good, still a bit uncomfortable.
Is there temperature?
You've got a temperature as well. So it all...
Last night when I start to have that stabbing pain, I was scared.
Yeah, no, I understand. It can be very scary when these things happen.
Oh.
Sorry, Mike's first time driving.
Not bad for my first time.
He's had his licence for 2 weeks now.
Oh.
No, I'm joking. He's had it a long time.
I'm only 16.
One thing I can do straight away for Amelia is to make her smile. And the best thing I've got in my arsenal at the moment is the charm offensive. You know, it's okay. We'll look after you, all right?
Yeah.
We'll take care.
My grandson.
I'm your grandson.
Of course.
So does this mean I can come over and you'll cook me dinner?
Yes, when I get better, why not?
Perfect. I'll be there tomorrow. How's that sound? Mike, what are you doing for dinner tomorrow night? We're going to Amelia's.
Going to Amelia's?
I can't do it.
You need to rest. I think patients, they never remember the medications we give them. They don't remember the procedures. What they remember is how we interact with them and how we made them feel. Maybe if I was 40 years older, you and I.
You're beautiful.
Whenever I go to a patient like Amelia who's home alone, I think of my own Nana and think, oh, when was the last time I checked in on her?
Few bumps and noises, OK, Amelia?
For part of me, all of these older patients are a little bit my Nana, and I want to treat them as they deserve to be treated.
That might be your fever breaking because you've had some Panadol.
Amelia will now be given a chest X-ray to find out just how serious her condition is.
I'm a bit dizzy.
Could be my driving, let's be honest.
Definitely your driving.
Are you certain it was a funnel web?
Well, that's where they all are.
Where were you bitten, Jess?
On my finger here.
It's been 2 weeks since Mum Jess was bitten by what she believed was a highly venomous funnel web spider. Jess was treated with anti-nausea medication and monitored overnight before she was allowed to return home to her family. The other good news is the landlord did organise pest control, and Jess's 3 kids are now safe to play in a spider-free backyard. Amelia was diagnosed with a severe chest infection and required multiple courses of antibiotics. The 72-year-old spent 5 days in hospital before she was well enough to return home.
So does this mean I can come over and you'll cook me dinner?
Yes, when I get better, why not?
Perfect. I'll be there.
As for Eamon, he's still looking forward to his dinner invite.
So she's allergic to eggs, dairy and peanuts.
3-year-old Anna had an anaphylactic reaction after eating a burger with mayonnaise.
Sorry. I'm sorry, sweetheart.
She remained under observation for several hours and was discharged later that night. Doctors have confirmed she's allergic to eggs, and the toddler's mum now makes sure her little girl has an EpiPen on hand at all times.
There's the cows, Laurie.
No, the cows are right there down the bottom paddock.
72-year-old farmer John was at serious risk of going into cardiac arrest after having a massive heart attack.
You stay with me.
At hospital, he underwent emergency surgery that saved his life.
Come on, over here!
Back on the farm, John's enjoying his second chance.
They know your voice.
Yeah. Lauren was persistent. She called the ambulance. I told her not to. But being in their hands was absolutely fantastic. I actually trusted my life with them. Yeah, I'm dangerous when I've got this in my hand.
Knock you out.
Since the heart attack, John's making the most of every day.
He's a lot more healthier and he's a lot more, a bit of a spring in his step. He's just a ball of fun now.
Aren't you glad I'm alive? Eating good pizza.
It is good to have him back. He's stubborn, but much improved now that he's had his operation.
Here's to those wonderful paramedics. Good luck to you, Ray.